Are recliners bad for your back? Many people swear that their recliner is the only way that they can get comfortable when they have back pain or sciatica. And yet other people say that using a recliner actually makes them hurt worse. Hi, I'm Dr. Dave Candy, and in this video, I'll explain how to use a recliner to help your back pain and what to avoid so that you don't make it worse. So first of all, what are the arguments for using a recliner? Well, there was a 2006 study that showed that reclining back at a 135-degree angle between your trunk and your thighs actually helps increase disc height as compared to upright sitting or forward lean sitting. Now, this was presented at the North American Radiology Conference, but as far as I could find, it was never actually published in a peer-reviewed journal. Now, on the other side of things, people claim that sitting in a reclined position encourages a slouch seated posture, as well as that sitting with your legs extended like this puts your sciatic nerve on tension for a prolonged period of time. So what do you do to maximize the benefits while avoiding the downside? Well, largely it depends on how you sit in the recliner and how your recliner fits you. When you're sitting in a recliner, probably the worst thing to do is to have your legs all the way out straight and be sitting up at a 90-degree angle like this. At this angle, gravity has a maximum downward compression on you. Your lower back is rounded out, which does increase disc pressure, and your sciatic nerve is on tension. This is one of the reasons why many people get sciatica when driving, because they're in this relative position for a long period of time. So if you are going to use a recliner, it's probably best not to sit with your legs all the way extended like this, and especially not while your back is upright. You actually want to recline in your recliner. Now, how far do you recline? Well, that's going to be dependent on each individual person and the individual chair. But there are a couple of things to keep in mind. When you're sitting upright, the hinge for the recline is back about here, but your hips are right here. So in the ideal world, the hinge should be right about at your hip joints. But in reality, the axis of rotation of the chair is usually behind your hip joints. And so what ends up happening as you move from an upright position back into a reclined position, it actually throws your lower back into extension. Now, if you have degenerative disc disease or spinal stenosis, those type of conditions don't really feel good when you arch your back or extend your back. So as you lean backwards, in order to avoid a backwards extension moment at your lower back, you may actually have to push yourself further back up into the chair so that you're still supported by the backrest of the chair. Additionally, it's probably good to have your knees slightly bent like this so that it takes some tension off of your sciatic nerve. It's not all the way straight out like this. And it allows you to recline back so that gravity is no longer compressing vertically down through your spine, but it's actually creating more of a translatory force. And then you're pushed all the way back into the chair so that there's no gap between your lower back and the chair. And that way the chair helps resist that translatory force of gravity. Now, if you have neck pain, if you're reading or watching television, it may also be a good idea to put a pillow behind your head so that your neck's not cranked back into extension, which can also be uncomfortable if you have degenerative discs in your neck. Now, furthermore, if you still feel uncomfortable sitting in a recliner in a position like this, another tip that can help is bending your knees upwards so that your feet are actually resting out on the bed of the recliner. What this does is it further pushes you back into the chair. It also increases the flexion angle of your lower back, which again, if you have degenerative disc disease or spinal stenosis, you may feel better in a relatively flexed posture as compared to more of an extended posture. Turning your knees out slightly into the armrests can also help open up your hip joints if you do have a little bit of hip pain or hip arthritis when you're sitting with your knees at more of a 90-degree angle. So again, to review, using a recliner can be incredibly good for your lower back, but you want to make sure you're using it in a way that fits your body and your condition to the chair. It's probably best to avoid an upright sitting position like this with your legs fully extended, and probably better off to sit slightly reclined with your knees a little bit bent, and possibly even having your knees bent up and your knees turned outwards so that it pushes you back into the backrest. You're fully supported, and it puts you at more of a 90-degree sitting position where you're sitting with your back and hips at roughly 90 degrees, but then you're reclining the whole unit backwards so that it also offloads the compression force coming down on your spine due to gravity. So hopefully you did find this video helpful. If you do need more tips to help relieve back pain and sciatica, check out our back pain and sciatica playlist over there. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.